Good morning. We're here today to discuss Oregon's next steps as we transition into a new chapter of the COVID-19 pandemic. I'm joined by Patrick Allen, Director of the Oregon Health Authority, Dr. Dean Seidlinger, our state epidemiologist, and Colt Gill, Director of the Oregon Department of Education. Before we start with the COVID update, I wanted to take a moment to address the accomplishments of this year's legislative session. Very soon, the legislature will adjourn sine die. This session has truly marked a turning point for Oregon. We have been fighting COVID-19. We are getting Oregonians back to work, and we are making sure our recovery efforts are reaching everyone. There are so many challenges ahead for our state, from the economic impacts of the pandemic to wildfire recovery and preparedness, to addressing systemic racism. We recognize that we need to build back stronger and better to create a more just and equitable Oregon. This is so important, and I'm incredibly thankful to Oregon's Racial Justice Council, Reimagine Oregon, and the entire BIPOC caucus in the legislature for their leadership in addressing Oregon's history of racism and division. I'm also very proud of the many bipartisan votes that have advanced Racial Justice Council sponsored bills this session. When policymakers hold authentic community engagement and have honest and open conversations about race, the result is thoughtful policy that helps us move forward. We've seen that this session with bills like House Bill 2166, which focuses on creating culturally specific education settings for our children and youth. And Senate Bill 289 takes steps toward reducing and eliminating bias crimes to make our public lands safe for all Oregonians. And as we enter another weekend of record high temperatures, another priority is Senate Bill 762 on wildfire response and preparedness. After last year's fire season, it was very clear that no corner of our state is immune to fire. This bill improves and modernizes Oregon's wildfire preparedness with 3 strategies: creating fire-adapted communities, developing safe and effective responses, and increasing the resiliency of Oregon's landscapes. I hope to see the legislature pass this bill soon so we can continue to make critical investments in our communities across the state for this fire season and for seasons to come. Thank you to everyone who worked hard this legislative session to help make Oregon a better, safer, and stronger state. As we near the end of June, more than 15 months since the first case of COVID-19 was detected in Oregon, we find ourselves entering a new chapter of the pandemic. More than 2.3 million Oregonians are now vaccinated, and we are quickly approaching the point where 70% of Oregon's adults have received a first dose. Thanks to the widespread availability and adoption of the vaccines, our case rates are declining and our communities are safer. We have certainly faced some really difficult times over the past year, and yet together, Oregonians have made extraordinary sacrifices that have protected our communities from the spread of this disease. Oregon has consistently ranked amongst the lowest per capita case counts in the nation and among the lowest COVID-19 infection rates and deaths. In December, when the arrival of safe and effective vaccines marked a new, hopeful phase, we still had to work our way through the early days of a painfully limited supply. Now, thanks to the tireless efforts by state and local public health agencies, hospitals, health systems, pharmacies, and community-based organizations, these life-saving vaccines are readily available to any Oregonian ages 12 and older. Just this past Monday, I saw a young man who had just turned 12 the day before excitedly line up at a community clinic to get his first dose. The vaccines have proven to be our strongest defense against COVID-19. I'm so proud of our collective efforts to vaccinate more than 2.3 million Oregonians. It's because of these successes that we can move Oregon forward and into the next chapter of the pandemic. I know we're all certainly ready. To give Oregonians certainty as we prepare to transition into this next phase, when Oregon reaches 70% of adults vaccinated, or by Wednesday, June 30th, whichever comes first, we will lift the safety protocols we have relied on and reopen our economy. As I have detailed before, that means no more statewide mask mandates in most settings, no required capacity limits, and no required physical distancing. It means effectively, Oregon is 100% open for business. This is a pivotal moment for Oregon. We must also recognize that it has been exceptionally difficult for our Black, Indigenous, Latinx, Asian and Pacific Islanders, and tribal communities. Disparities that existed before are even wider now. I am incredibly grateful of the work that our local health partners and community-based organizations have done to reach Oregonians from communities of color to make progress closing the equity gaps in our vaccination efforts. Unfortunately, COVID-19 is likely to be present in our lives for months and possibly years to come. The lasting impacts of the hardships Oregonians have borne during the pandemic will be with us even for longer. While we certainly see encouraging signs, communities and economies do not recover overnight. As we transition to recovery, we must do everything we can to ensure we are equipped with the ability to remain nimble and resilient. We must be prepared to respond to the emerging needs of our workers, our businesses, and our economy. Today, I will be signing an executive order that will lift Oregon's risk level framework and all remaining COVID-19 health and safety restrictions that have been issued under Oregon's emergency statutes, effective when we hit 70% or June 30th, whichever comes first. Similar to the emergency order that I issued last fall to support recovery from the Labor Day wildfires, this EO will continue the emergency declaration for the limited purpose of supporting the state's recovery from the ongoing COVID-19 pandemic. This action will give Oregon the flexibility and access to resources needed to aid in our recovery efforts. Brighter days are certainly ahead, and we are more determined than ever to make sure that we ground our state in a strong recovery that reaches every single Oregonian as we turn a new page on this chapter of the pandemic. Our work isn't done, but we can all take a moment to celebrate that by next week. We will all be moving forward together. Before I turn it over to Director Allen, I want to address one more very important issue, and that this is this weekend's record high temperatures. Parts of Oregon are projected to see temperatures well over 100 degrees, and in some places 110 degrees. This means the threat of wildfire activity is high. We also need to take extra precautions to make sure our families, our neighbors, and our pets remain cool and safe. Here's a couple of things you can do to stay safe this weekend. Drink more water than usual. Don't wait until you're thirsty. Limit outdoor activity, especially in midday when it's hottest. And please check in on at-risk friends, family, and neighbors, including those neighbors experiencing unsheltered homelessness. Please stay safe out there. And with that, I'll turn it over to Director Allen.
Thank you, Governor Brown. I'm Patrick Allen, Director of the Oregon Health Authority, and I'm here today with Dr. Dean Seidlinger, our State Health Officer, who will be available to answer questions. This morning, I want to tell Oregonians that we are on the doorstep of a 70% adult vaccination rate. I also want to remind everyone that COVID-19 still poses a serious risk for people who are unvaccinated and for undervaccinated communities. 98% of people who are dying from COVID-19 are unvaccinated, and more contagious and possibly more dangerous variants are spreading in Oregon, posing a threat in counties with low vaccination rates. Today, I'll talk about how we plan to work with county commissioners and public health officials to stem outbreaks and keep Oregonians safer after reopening. Finally, I want Oregonians to know we're not finished vaccinating vulnerable people. Oregon remains committed to vaccinating as many eligible people as we can, with a long-term aim to reach 8 in 10 adults, particularly in communities of color, which have been hardest hit by the pandemic. We're going to work to vaccinate enough Oregonians to end the pandemic and keep the virus from surging back. Now, let's look at where we stand today. Based on the latest CDC figures, Oregon has vaccinated 69% of adults. Oregon ranks 18th in the nation in total population who've received at least one dose. According to the CDC, 58% of all Oregonians have had at least one vaccination. The national average is 54%. Today, 2,365,492 Oregonians have received at least one dose of a COVID-19 vaccine. It's no secret that vaccine demand has tapered in recent weeks, but we continue to reach Oregonians every day with a vaccine. And when we look inside the numbers, we see some surprising and encouraging bright spots over the last full week of reporting from June 13th to the 20th. At the county level, we're seeing an uptick in some rural counties. Over the past week, the 7-day vaccination rate of growth across the state has hovered right around 1%. Today, there are 8 counties who have vaccinated 65% or more of residents aged 16 and older. That's Benton, Clackamas, Deschutes, Hood River, Lane, Lincoln, Multnomah, and Washington counties. However, the rate of growth in those counties has slowed. All these counties are at less than 1% growth. In contrast, 14 counties have vaccinated fewer than 50% of their residents who are 16 or older. However, Crook, Gillum, and Umatilla counties all grew between 1.4 and 1.8% last week, faster than the statewide average. And in counties that have vaccinated more than 50% of their residents who are 16 or older, Clatsop, Jefferson, Marion, Sherman, and Wasco all saw growth rates of 1.3 to 1.8% last week, again faster than the statewide average. While many of these counties still have low overall vaccination rates, these growth spurts are an encouraging sign that we can reach more people. These signs of growth may also tell us incentives are helping in some areas. Growth in vaccinations among younger people exceeds the rate of increase among older people. Growth among Oregonians who are between 12 to 15, 16 to 19, and 20 to 29 years old all increased between 1.5% and 4.5% over the past week, which outpaced the statewide average and the growth rate among older adults. In contrast, no age group among people 50 and older grew by more than 0.5 percentage point last week. However, Oregon is at 73% or above for people who are 60 and older. When we look at race and ethnicity, our overall statewide growth in vaccinations is being carried by people in communities of color. Over the last week, vaccination growth among people of color continued to outperform whites. Vaccination rates among Blacks, American Indians and Alaska Natives, and the Hispanic Latinx community all grew by 1.4 to 1.6%, exceeding the statewide growth rate and at least doubling the rate of growth among whites, who grew at just 0.7%. We couldn't have made this progress without the central role community-based nonprofits have played in organizing events and reaching out to the communities they serve. OHA has received requests to help support vaccination clinics from more than 90 nonprofits in Oregon. Here are some examples of the events we've organized. The Oregon Marshallese Community Association and the Woodburn Ambulance Service held a vaccination clinic at an annual OMCA softball game, held to celebrate Marshallese Constitution Day at the South Salem Friends Church. The Latino Community Association has held several vaccination events in Crook, Deschutes, and Jefferson counties, including an event 2 weeks ago in Harwood Park in Prineville, co-hosted by Crook County, the Crook County Public Health Department, and Oregon Child Development Coalition. The event featured a live DJ, food, and a healthy serving of the Johnson & Johnson vaccine. Seed of Faith Ministries recently partnered with the Urban League of Portland and Salem for Refugees to host a vaccination clinic in Salem. At this event, Rite Aid and JD Health and Wellness provided vaccinators, as well as all 3 authorized vaccines. The houseless community received rides to the event, and the organizers provided a barbecue, music, and health resources. Other events have offered free haircuts as well. Utopia PDX, in partnership with the Q Center, has been hosting vaccination events to celebrate Pride Month. To celebrate Juneteenth, they held a clinic focused on Black, lesbian, gay, queer, trans, non-binary youth and their parents. Oregon's rising vaccination rate is driving COVID-19 out of many homes, workplaces, nursing homes, schools, and daycare centers and hospitals. But as Oregon reaches the verge of reopening, we can't forget the pandemic isn't over among people who aren't vaccinated. The vaccines have proven themselves. They are safe and effective. The latest Oregon data shows that more than 9 in 10 COVID-19 cases and hospitalizations occur among people who aren't vaccinated at all or who aren't fully vaccinated. Nearly every person who died of COVID-19 in the past month was unvaccinated. Yet today, 7 counties need to vaccinate more than 10,000 people just to achieve a 65% vaccination rate among people 16 and older. Low vaccination rates in local communities are dry tinder for new COVID-19 outbreaks to emerge and new variants to evolve. So how will Oregon manage these risks after June 30th once the current statewide protections expire? As Governor Brown said, we will lift statewide mask mandates, capacity limitations, and social distancing requirements next week. Before vaccines arrived and during the early days of the vaccine rollout, these protections were the only tools we had to slow the spread of the disease, and they worked. If Oregon had suffered the same death rate as the nation, 4,000 or more Oregonians than we've already lost would have died. Now, with an adult vaccination rate of nearly 70%, we can pull back the statewide protections for the virus forced on us and shift responsibility for managing COVID-19 to the local level. Going forward, it'll be up to county commissioners, who act as local health boards, and local public health officials to intervene to slow the spread of COVID-19 in their communities. They'll be responsible for conducting case investigations and contact tracing, ongoing vaccination efforts at the local level, and implementing other needed interventions, such as social distancing protections or any additional mask requirements. At OHA, our role will be to collect and report data, provide epidemiological analysis and support to local health officials, provide backup case investigations and contact tracing support, continue to assure adequate COVID-19 testing is available to Oregonians, monitor the emergence of variants, and continue to allocate vaccine supplies and support vaccination efforts, especially as we work to meet our goal to vaccinate 8 in 10 people in communities of color by the end of August. This change is in line with the way our public health system operates in normal times, outside a global, national, and statewide health emergency. When there's an outbreak of meningitis, measles, or other communicable diseases, local health authorities take the lead. OHA's role is to provide support and fill the gaps, such as state public health lab testing, cross-county coordination, and other roles. Some local officials have been very vocal in asking for this authority earlier in the pandemic, but that didn't make sense when we had higher rates of COVID-19 all across the state and high rates of hospitalizations combined with lower rates of vaccination. For the past 16 months, we've needed an altogether pandemic response to confront a new and deadly threat. But now, with infections down statewide and vaccinations up, we can shift from a statewide posture to a footing that looks different in each community depending on their local risks. Don't get me wrong, this is not a go it alone moment, even if some people may want their local leaders to pretend the pandemic is over. Many unvaccinated people in Oregon remain highly vulnerable to COVID-19, especially as new variants that are more contagious and cause more severe disease are spreading in Oregon. And hospitalization rates remain high among Black Oregonians. COVID hasn't gone away. We still need an all-together attitude. In keeping with that spirit and with the way the public health system is designed to function, OHA will continue to help local health officials take appropriate action to save lives. But local officials will be responsible for making those decisions and responding to the consequences in their communities. Which brings me to my most important message. We're not finished vaccinating Oregonians. A 70% vaccination rate among adults is a major accomplishment. As Dr. Seidlinger has shown, our rising vaccination rate corresponds to a decline in COVID-19 cases, hospitalizations, and deaths. It's made a safer state reopening possible. I want to say thank you to every Oregonian who's been vaccinated and everyone who's worked hard to vaccinate Oregonians. But we can't stop there. Too many people do remain at risk. We've made a commitment to leaders representing communities of color. We will vaccinate 80% of adults from tribes, from the Black, Latino, Latina, Native Hawaiian, Pacific Islander, and Asian communities. We're working hard to honor that pledge. We've also committed to forging on past 70% for all adults and work toward reaching as much as 80% of all adults before we're through. We want to vaccinate enough Oregonians of all eligible ages to achieve the critical mass of immunizations that's necessary to truly bring this pandemic to a close. To achieve these goals, we're expanding vaccination efforts sponsored by nonprofits, standing up a ground game that will send canvassers into under-vaccinated communities, and expanding our public education messaging tailored to address the questions we hear from different communities. Once Oregon reopens, I want to let you know OHA will also adjust our COVID-19 data reporting. After June 30th, we will maintain our weekday reporting of cases, vaccinations, hospitalizations, and other data through our daily news release, social media updates, our popular coronavirus update newsletter, and online dashboards. However, we'll discontinue our weekend and holiday reporting, which includes our weekend news release, weekend newsletter, weekend social media posts in English and Spanish, weekend Tableau dashboard updates, and weekend hospital capacity reporting. We will do catch-up reporting on Monday or the day following a holiday. During weekends, we will continue to have public health officials ready to address urgent issues and have a public information officer on call to monitor emergency media requests. Finally, I want to encourage everyone to stay safe this weekend in the extreme heat. According to the National Weather Service, many parts of Oregon are expected to reach record-breaking temperatures over the weekend, as high or higher than 104 in central and eastern Oregon, 107 in the metro area, and up to 112 in south central and southwest Oregon. The OHA and CDC websites have good tips on how to stay cool, stay hydrated, and stay informed about the symptoms of heat cramps, heat exhaustion, and heat stroke, and ways to avoid and treat those serious conditions. OHA is also working with local public health officials to connect people to cooling centers, and we're making emergency revisions to our guidance to review capacity limits in certain settings during this historic heat emergency. And while many vaccination clinics will cancel events this weekend, we're working to see if we can offer vaccinations at some cooling center locations. If you need access to a cooling center in your community, call 211. Please be careful and stay cool this weekend. With that, I'll turn it back over to you, Governor Brown.
Thank you, Director Allen. And Charles, we're ready for questions.
Thank you, Governor. For the reporters on the line, we'll be using the raise your hand function again today to ask questions. We'll start first with Lisa Balick from KOIN. Go ahead, Lisa.
Yes. Good morning. Governor, since the vaccination numbers are not exact and we're so close, why not call it good for now and lift the restrictions and especially allow vaccinated Oregonians to lose the mask with the record heat coming?
Look, at this point in time, we nearly have 7 out of 10 Oregonians vaccinated. We just want to keep up our vaccination rates for the next several days. And obviously, we are working with our local partners to make sure that there are cooling centers available for our vulnerable Oregonians. And we're lifting capacity on public transit so that folks can ride safely and coolly.
But Governor, with the heat, it seems like it's almost punishing those who've done the right thing and got vaccinated, that they'll still have to wear the mask with this record heat.
Lisa, we're going to keep moving forward. As I said, we have nearly 7 out of 10 Oregonians vaccinated. We want to make sure we continue these vaccination efforts for not only the next few days, but the next several months. Our goal is to continue to aggressively vaccinate individuals. And we're working with our local community partners to make sure that cooling centers are available and open for vulnerable Oregonians.
Governor, could I add briefly to that?
Sure.
Masks are already not required for people who are vaccinated. There may be circumstances where a setting doesn't want to check whether people are vaccinated, but in general, people who are vaccinated are not required to wear masks.
Thank you, Lisa. We'll go next to Pat Duris with KGW. Go ahead, Pat.
Thank you. Governor, just one quick clarification. The document you signed, was that executive order repealing those others?
It's essentially an extension of the executive order. It is focused on recovery efforts moving forward, but obviously it would repeal the distancing requirements, the social distancing requirements, and the masking requirements. Effective when we reach 70% or June 30th, whichever comes first.
Which leads to my next question then. Could you share some of your thinking about deciding on June 30th? How long have you been thinking about that? Was there one thing that pushed you over? And why does the 30th make sense? Thank you.
Great question, Pat. My goal has been to reach 70% of Oregonians. We are nearly there and expect it to happen in the next several days. Obviously, businesses and venues need certainty in terms of reopening and when we will fully reopen. And at this point in time, we've vaccinated over 2.3 million Oregonians, nearly 7 out of 10. And we obviously will be moving in alignment with Washington. We're hoping to beat Washington, of course.
Okay, thank you.
Thank you, Pat. We'll go next to Ben Botkin with the Lund Report. Go ahead, Ben.
Yes, Governor. I was hoping you could just comment on the idea of whether or not you have any concern that announcing the lifting of everything on June 30th, regardless of whether we hit the 70%, whether you're concerned that that will make people less inclined to get a vaccination now that they know those restrictions will lift. Thanks.
So as we mentioned, as both Director Allen and I mentioned, we are going to continue our vaccination efforts, partnering with our local public health partners and our community-based organizations. And I am absolutely committed to making sure that as many Oregonians as possible, ages 12 and over, receive the vaccine. We know the vaccine is the most effective tool that we have to combat COVID-19. It's the best way to protect yourself, your family members, vulnerable community members, and to prevent hospitalizations and deaths. So we are going to continue our efforts and expect that it will move to a more localized effort. On Monday, I was at a middle school in Southeast Portland. I know in talking to both parents and young people there, that they were there because a trusted community partner encouraged them to go get vaccinated. I also talked to other folks. Dr. Don Spite from OHSU was literally outdoor knocking. So this will be more of a one-on-one effort, an effort in collaboration with our trusted partners at the local community level. And we're going to keep it up because we know this will keep our most vulnerable communities safe, and we know it will help prevent the transmission of the virus. Director Allen, would you like to add any additional information?
Just that I think the growth rates that we're seeing in communities of color are especially encouraging, that there are still people who need access and information and encouragement from trusted partners, as the governor alluded to get vaccinated. And that's really who we're going to be focusing on. And that's who already is driving the growth in vaccinations in Oregon. And so I don't think a change in status on the 30th will damp that, but it's hard work, and we need to all work together to continue to get folks vaccinated.
Thank you, Ben. We'll go next to Fedor Zarkin with the Oregonian. Go ahead,
Hello.
Fedor.
Hi, this is a question for Pat. So with the reopening of the state, how much do you expect cases and deaths to grow, and over what timeline? And depending on how much cases climb, will you consider reinstating statewide restrictions?
Well, I think the point of targeting a 70% vaccination rate amongst adults was to, when combined with people who are immune through exposure, to get to a high enough level to have a meaningful impact on driving down numbers of cases and the rates of hospitalizations and deaths. That's not the same thing as herd immunity, but it's good progress to help reduce the impacts of the pandemic, the virus. And certainly we're at that stage, and you can see that reflected in our case counts and our dropping hospitalization rates and our dropping fatality rates. I do think what will happen going forward is there will be variations across the state in different communities based on rates of vaccination in those communities. And that's really what I was getting at with the discussion about how it will really now be local government that will be in the lead to respond to those variations and those circumstances and identify steps that need to be taken. It's really the governor's call whether we reimpose any statewide restrictions. I guess I would suggest that from an advice standpoint, I would suggest that nothing's off the table if we turn into turn a corner back and get into a really dire circumstance with some new variant or something like that. But again, people getting vaccinated is the best way to avoid that.
Fedor, we obviously don't know what the future holds, but Director Allen is exactly right. We're moving to a more traditional, localized approach in terms of our vaccine response. And hopefully, given our really proactive vaccine efforts and Oregonians' willingness to take the shot, we will be able to keep it that way.
Thank you. If I can ask just a quick follow-up. So as you said, we don't know exactly how things will play out. So is there a benchmark at which the state might, come in again and say, okay, we've got to take over again? Is there like a threshold?
Again, our focus will be to move this to a more traditional localized public health approach where local public health authorities will be working with local public officials to keep community members safe and healthy. Obviously, the Oregon Health Authority will continue to watch some of the key statewide indicators like hospitalizations that we have been watching throughout this pandemic. My hope is, given the incredible progress that we have made with vaccines, nearly 7 out of 10 Oregonians have their first shot, and our robust efforts continuing forward, that we won't need to get to that point.
Thank you.
Thanks, Fedor. We'll go next to Rachel Monahan with Willamette Week. Go ahead, Rachel.
I'm wondering if you could go over again, this is sort of a revisiting of Lisa's question, the first question, but from a slightly different angle. If you're going to open the state no matter what, why did you elect not to just go ahead today, given that there are extraordinary temperatures expected in some parts of the state? And obviously, venues like movie theaters, grocery stores, all of those places are cold and could serve people who don't have air conditioning at home, like many Oregonians do not.
Rachel, as I mentioned with Lisa, we are opening up capacity on public transit for our vulnerable populations and working with our local partners to make sure that cooling centers are open. As Director Allen mentioned, if you're vaccinated, in most places, you are not required to wear a mask. And we're going to continue to aggressively vaccinate in order to reach our goals over the next few days. Director Allen, would you like to pop in here?
Yeah, I would just say that we're looking at a variety of different kinds of capacity limitations to see in direct response to heat if there are settings that we can make changes to provide more opportunities for people to be able to stay cool.
And when will you be announcing those, or when will the public know about those, or the stores? Or
later today.
Thank you, Rachel. We'll go next to Julia Silverman with Portland Monthly. Go ahead, Julia.
Thanks so much for taking my question. I know that the Ready Schools Safe Learner guidelines aren't going to be issued for a few more weeks, but I'm wondering if you could address what this means for childcare summer camps, and also as much as possible for K-12 education. Thank you.
Thank you, Julia. The Department of Education is working closely with the Oregon Health Authority to update our guidelines. We're also obviously waiting information from our federal partners. And with that, I'll turn it over to Dr. Dean Seidlinger and Director Gill.
Thank you, Dr. Brown. I'll start with revision of guidelines. I'll let Director Gill talk a little bit more about Ready School Safe Learners, but across our school guidance, our childcare guidance, and our guidance for camps, we'll be issuing new guidance that will support these moves as we move towards an advisory piece that puts local control. We will follow CDC recommendations and recommend safety measures in place, including masking and physical distancing in locations where people are not vaccinated, but reduce the requirements, eliminate the requirements that are currently existing in the framework that guides all businesses in all locations and how they implement this framework. Certainly, we know that with younger children, those under 12, they're not yet eligible for vaccines, so that removes a layer of protection. So camps and childcare will implement other levels of protection based on community spread and level of vaccination in their community. These locations will have to have a communicable disease plan so they know what to do if someone with COVID comes to the location, how to contact public health so that they can exclude those people and limit spread in the facilities. We're really working towards a level where these recommendations are implemented based on the spread in the community, the vaccinated population in the community. I'll turn to Director Gill if he wants to go into a little more detail about our Ready School Safe Learners framework.
Yeah, thank you, Dr. Seidlinger. What I would say is Governor Brown has been sharing for the past few weeks, and the department has reiterated that we plan to return to full-time in-person instruction every school day next year. And in order to get there, we have created Ready School Safe Learners Resiliency Framework that will be released later today. It also becomes effective June 30th, so it can impact the decisions that local communities and school districts make around summer school and the health and safety protocols that they implement during summer school. These will be all guided through CDC and OHA guidance, but they are set up to direct local decision making. So again, local school districts will work with their partners at local public health authorities to make decisions around face coverings, physical distancing, airflow and ventilation, hand washing, all of those mitigation efforts that we know so well at this time, and think about how those work in schools that are mostly unvaccinated populations, like our elementary schools, and schools that are partially or fully vaccinated, like some of our middle schools and high schools now in Oregon. They'll also look at the local rates of COVID-19 in their communities as they make these decisions at a local level, and work closely with local public health authorities on quarantining and isolation when they do have a case on a site. I do want to add just one more thing, though. Our superintendents have been meeting the past few days. As you're aware, through the work of Governor Brown and the legislature, many of our schools in Oregon are implementing summer school at this time. And as they look at the high temperatures coming into early next week, many of them are making decisions to either move summer school activities to their sites that are air conditioned, or possibly to cancel some of those summer school activities during this high heat time. So I would just encourage all those families that are engaged in those activities to make sure that they're checking with their local school district to understand what provisions are being made around the heat early next week.
Thank you, Julia. Our last question in the queue today is from Aaron Ross with OPB. Go ahead, Aaron.
Good morning. My question is, there are several counties that have vaccinated less than half of their adult population, which has put immune-compromised people, children, and those who cannot have been able to receive the COVID-19 vaccine at risk. But we know that COVID-19 prevention measures have become politicized. So leaders in those counties have been and will continue to be under pressure to lift mask mandates and distancing requirements. And as you've said, we don't know what the future will hold, and vaccinations are the best way to prevent the emergence emergence of variants, but there are other ways. And it sounds as though nothing is off the table in terms of prevention if things get bad again, so I won't ask about that. But why are we dropping our second best method of preventing transmission indoors? Should we be proactive in preventing new variants? And most importantly, should those vulnerable unvaccinated people in those counties avoid indoor spaces and essential businesses, since masks are most effective at preventing transmission from an infected person and less effective at preventing a person from catching the virus?
Erin, I'm going to turn your multi-pronged question over to Dr. Seidlinger.
Thank you.
Thank you, Governor Brown, and thank you, Erin. I think as we move forward in this pandemic, we are seeing decreased cases here in Oregon, decreased hospitalizations and deaths. Vaccinations are our most effective tool at keeping that decrease going. As you mentioned, children and certain individuals are either ineligible for the vaccine or may not respond as well. So using a mask and potentially thinking about the activities they do in indoor public places helps to protect them. But also, if you live in a community with lower vaccination rates and you're not vaccinated, think about the activities you're taking. Think about the loved ones you return home to and whether they're immunocompromised or you have young children at home. You may want to continue to wear your mask in indoor settings. Vaccinations offer great protection, but we know masks, keeping our distance and limiting our gatherings have worked very well for us throughout this pandemic. This will allow individuals to make that choice as they protect themselves and their family, the loved ones that they return home to, while we continue to beat down this pandemic. We've done an amazing job here in Oregon as Oregonians have come together to keep our cases, hospitalizations, and fatalities down throughout this pandemic. And even as the potential for more communicable variants are arriving in the state, we know that our vaccines are effective. So for those who are vaccinated, thank you. For those who are not, please make a plan to get vaccinated. And for those who may be immunocompromised or may not have responded as well to the vaccine, think about the activities you take, continue to wear a mask, talk to your loved one and family members about times that you get together so that you can take precautions to protect yourself, your family, and all of those around you.
And
So,
Erin,
Dr.
this is, go ahead. Go ahead.
Oh, it sounds as though you're saying that going forward, staying safe will be on the individual. And knowing that many unvaccinated and potentially contagious people will not be wearing masks, should those individuals who are immune compromised or unable to get vaccinated avoid essential businesses like grocery stores, which have a lot of people and can be big sources of transmission?
Dr. Seidlinger, go ahead.
Thank you, Governor. Erin, I think individuals need to make some choices about the protective measures they take. While that mask does serve to protect others from a person who's infected with COVID-19, wearing a mask can also offer you some protection. So as we've done during this pandemic and people have made choices about the activities that they participate in, how they move about in our community, I think individuals will continue to make those choices. With lower levels of disease in the community, more people vaccinated, even those who are unvaccinated have more protection right now than they did during our fall and winter surge when cases really raged here in Oregon and across the state. Certainly, individuals who are not vaccinated or immunocompromised may consider changing some of their activities, may talk to friends and families about the way they get together and continue some of the precautions they've had over the last year until those cases come down even more. But really, the environment right now with vaccinations driving down infections has allowed us to move into this location where individual local decisions can be made based on community circumstances. And those individuals and families, parents of children, will make decisions about the risks that they may be taking when they go out, but also the protection that already exists from our high rates of vaccinations. Almost 7 out of 10 adult Oregonians already having received at least one vaccine. We can continue this progress. 7 out of 10 is not the end. We need even more, and particularly in our communities of color, we need to do better about getting more people vaccinated. So I think those things together will allow people, even those who are immunocompromised, to make decisions to keep themselves safe and still participate in some of the activities that they've given up over the last year and a half.
And Erin, this is Governor Brown. I just wanted to add that we will continue to follow federal guidelines regarding masking requirements. So for example, federal agencies are now requiring masks on public transit, as well as in healthcare settings, certain healthcare settings. So we will continue to follow those guidelines as well moving forward.
And this should be a very quick last one. Dr. Seidlinger, in the past, you spoke of two pandemics, of one that was raging in unvaccinated people and then where vaccinated people were fairly safe. And of course, we now know that the Delta variant is circulating. I mean, it has been circulating here for a while, but is certainly posing an increased risk. Are we still seeing that two pandemics? Do we know what sort of transmission rates we're seeing in unvaccinated people right now?
Thank you for that question. I think the indications we have is that pandemic continues. We'll release a new breakthrough vaccine report next week based on June data, but the data from March through May is very clear. The people who are getting sick with COVID right now, the people who are being hospitalized in Oregon right now, and the people who are dying from COVID-19 right now are not fully vaccinated. The people who are fully vaccinated are protected from this disease. They're protected from this disease themselves. If they do get sick, they may have a mild illness and be less likely to transmit it on to others. And the more people that take that step to protect themselves and their loved ones around them, the better community protection we'll have, even in the light of increasing variants that are more transmissible and cause more severe disease. What we know about the variants that exist right now in Oregon is that the vaccines we're currently using are effective. If you're fully vaccinated, you have protection against these new variants. We'll continue to monitor for emergence of new variants, either from other parts of the world, the country, or that are appear right here in Oregon. But for now, the vaccines we have are effective against the original virus, the Delta variant, the Gamma variant, and the other variants circulating. So if you haven't already gotten your vaccine, please make a plan. If you have, thank you. This is the best protection we have to continue reopening Oregon and getting back to a full economic recovery, enjoying the summer activities we've all missed so much, and seeing friends and loved ones without fear of getting sick.
Thank you, Aaron. Governor, that's all the time we have for questions today.
All right. Thank you, everyone. Please stay safe out there. Make sure you drink lots of water and stay out of the hot sunshine during the middle of the day. Have a great weekend.